Woo! Guys, what's going on? This has literally been an all-day affair. So what I want to do is walk you through what I did, as soon as I woke up until now. And now it's about 10 p.m. at least. If I can find my watch to verify. Let's see, we'll turn it on here. Oh yeah, it's pretty late. Let's say it's 10:47 now. But basically I woke up at 6 and somehow I was still running low on time to get there. I had to do a bit of work and then I had to shower up, because one thing you have to do before you go in the morning is to shower with this antiseptic shampoo that they give you. They give it to you on the pre-op day, and it's like a red shampoo. You need to use it for at least 5 minutes. And then, I had to blow dry my hair and I had to get ready, look presentable, and just get I don't know how it took me so long, but it did. It was mainly because I had to do some work, because I knew the whole day would be occupied. So, if you're a business owner or just anyone, even if you're just working, I'm sure you have stuff to do that you have to take care of before you're basically absent for a whole day if there's other people waiting, depending on you. Anyway, so I got there. The appointment was scheduled for 9 a.m. So after running to McDonald's and just smashing a couple of sausage egg McMuffin with cheese sandwiches, they were delicious. I love those things. And two of them is just, I got there about 8:50. So when you walk in there, there's a security guard. They'll show you to the door, help you change your shoes. And they're doing this like spray thing, COVID era, to sanitize the shoes. You walk up, and when I got there, it was just the receptionist. Lovely lady. I've seen her multiple times. It's hard for me to know people's names, which makes me feel a little bit, I don't want to say weird, odd, or unusual, but the thing is, they know your name because they have the patient files, but it almost feels like something halfway to, anyways, you know what I'm trying to say. So I got there, it was pretty quiet. I guess she had just turned the lights on, but that new office they have is incredible. So just sitting there is nice and relaxing. You can easily pass some time there. They got a lot of nice decorations. One of the walls is just a huge window, and it's just, I love that style. So I was chilling there for a good 15 minutes. I had a little chat with her, and I was just telling her, I walked from Adi, I had a couple of McMuffins and stuff, and asking her about the office and just the normal stuff. And then finally one of the other personnel came in, and she was like, "Okay, Saul, you ready?" And I was like, "Oh yeah, let's do it." I was just browsing Instagram. I'm definitely ready. I'm here. I'm always ready, and I'm early. So that was about 9:05. We walked in. We went upstairs, because that new building they have has like 5 floors, 6 if you include the rooftop. So we went to it was like the 3rd or 4th floor. And then she just shows you into a room, and you change in there. So they have like the patient outfit, which is just like this blue thing. It reminds me of those the massage outfits you put on when you go to a massage place. But these ones are a little cleaner, more professional, and they don't have buttons. They have little ties, so you got to tie them up. But I just slipped those on. I got my stuff ready on a hanger. I put like my phone and all my cards inside of this little, I brought one of these, which I think would be helpful if you just had a little bag. Some people call it a man person. In the US we call this a fanny pack. So it's a little more fashionable than a standard man bag. But anyways, put all your stuff in your pockets in there, and then it'll make it easier to get to, I guess, because you do take breaks throughout the day. So I did all that, and then they showed me to another room, and this room was basically, so this is key. I want to talk about this one, because this is where they draw the line on your head. Now, like I mentioned, sometimes they'll do it the night before, but I was like, let's just do it the morning before, because I don't want to be walking around with this lines on my face. So I went to W District and stuff yesterday in Prakanong. But so yes, the first thing he'll do was he drew the line. Now, I thought it looked slightly different than the one they did during the consultation, but either way, I thought both of them looked good, because really it's like, anything's going to be an improvement, right? So it's hard to say that it looks bad, but the thing is, it's just, I guess the frame of mind that I would advise other people when they go in there is, don't just think of something as, good or better than what you have. Think of which one is best. So one thing that I would have done is when they drew the line, I said, oh, it looks good. But I did ask him about it because, here, the line basically, or my hairline, it was going out, it was going in a little bit. So not only was the top part going up, but this side part was going in. So it created like a big kind of circular area there. And I asked him, I was like, is that normal for it to not just go straight up, and instead of going a little up and then back and then rounding? And he was like, well, yeah, it's normal. That's not entirely unusual. And I was like, okay. So the dynamic here that I find interesting, though, and that I want to advise you guys on, is that yes, the doctor, he's so good and he's so professional. It's hard you're not really going to want to say, oh, no, that doesn't look right. But really, he's actually very receptive to feedback. So if you ask something or request something, I think he's surprisingly, he'll be open to it. He'll let you know, or sometimes he'll just say stuff like you didn't even know was possible. And that's one thing I'll mention that happened at the end of the operation. I was like, I didn't know you could do that. But then there's a number of people in there. One of the ladies, I think her primary responsibility is to help with the hairline and stuff. So she did that, and she gave another option where, see, I don't have a problem with the frontal hairline. So they said, okay, let's not lower it as much, just a tiny bit, a millimeter or two, and we'll move more of that surface area towards the temple areas. And I said, yes, that sounds good, or even better, because that's what I was focusing on, was the temple areas. So, I don't have the photos right now, but basically, yeah, it just it covered more of the temple. And instead of the line on the side going a little up and then in, it was more like just going straight up and then rounding off with the top part of my hairline. So I was quite happy with that, and good thing the lady was there, and other people are getting input. As good as the doctor is, of course, he has a great team around him. The team there, A+, excellent. I love them. So yeah, so we've settled on the second one. So if you go there and you get one, it might be a good idea, don't ask for 3, or maybe you could really, but at least to check another option. Just say, oh, do you have any other ideas? Or if you have some sort of other idea, just ask for it. Because really, drawing the hairline, they're just drawing it on. It's not like they're putting the hairs in. So that is one thing I would say is key. And they mentioned that too. They say, this part is important. So they're definitely getting loads of feedback and stuff there. After that's done, they draw the line. Another one of the personnel there takes a number of photos from every angle from behind and stuff, and then they lead you into the room. One thing they did, because mine was FUE, was first they're like they cut the hair off the back. They cut the hair off the back, and also what they do is they cut the hair on the bottom, so they'll make the strip, like, let's just say somewhere in the middle or lower middle. And then below that line, where that scar or incision is where they will pluck, the FUE, the single hairs from. So they're going to cut basically, all the FUT portion, and then everything below it, which is where they're going to get the FUE. They need the hair to be short, because to do the FUE extraction, it needs to be very short. It can't be the same length that you normally have it, unless your hair is super short to begin with. So after doing that, they finally, they did the FUT first. So they're doing the cut, they're putting in, so right before that, they give you an antibiotic. They give you one antibiotic, and then they also give you 4 Valiums. And those are just, to help you go to sleep and whatnot. I hope this phone doesn't fall. So you're going to be feeling a little bit sleepy, which is a good thing. And they start doing the local anesthesia before, of course. So that is actually probably the most painful part, is when they're doing the local anesthesia, because it's just a sting. It's and they're doing so many, like at some point, it's just like there's just needles coming all. Okay, I'm exaggerating a bit, but it's uncomfortable getting a shot, let alone multiple shots. And then they do them every couple hours, and it's a very long day. So you're going to be getting a lot of needles in the back of your head. What I will say, though, is it's better to have those shots than to actually feel the pain, because, man, that would be I don't know, 50 times worse. It would be unbearable, of course. There's no way a normal human could withstand getting sliced open like that. Graphic, I know. One other thing is, they start, so don't be surprised if someone starts just kind of like thumbing or, massaging your legs, because that's something they do. They will massage mainly your lower legs, so like your knees and below your calves, and even your feet, they'll press on them a bit. I wasn't expecting that, but I remember they did that the last time, and that's just to calm you, to ease you, to massage, the tension, because your body is going through a lot of stress. So that's a nice touch. I'm not sure if they do that in other countries or if that's just like a Thai touch that they add on, because Thai massage here in general is a big thing in Thailand. It's part of their culture. So I really liked that. I think that was a nice touch. They are asking you questions throughout the whole time. They're asking you if you feel okay, if there's any pain on the left side, on the right side, especially when they're putting the anesthesia. I remember one time, they will consistently ask you that, because they don't want it to hurt too much. He asked if it hurt, and I said, "Oh, I'm not sure, maybe just a little on the left." I gave a long answer, and he tried to simplify. He was like, "Does it hurt? Yes or no?" And so I just said, "No." And so I think, sometimes I have that where I'm asking someone something like a yes or no question, and they give me a long answer. I'm like, what was the actual answer? So I guess, yeah, just keep it simple, and especially, when they're on the operation table, they're not trying to process and digest, a long answer, long email. No, they just need it simple, direct, and they're being very professional about it. I did fall asleep a few times, so I had to wear the mask because, this is just the COVID era times. And I remember waking up and my mask was just wet, and I was like, I think I basically drooled in, when I was sleeping, and it didn't go anywhere. It just stayed on the mask. So my mask was wet. And then I guess there was like a drippage of like some, one of the solutions that they're using came down on the ear loop. So I noticed that was red, and I had some saliva all over my mask. I was like, I'm a mess. When I went into the bathroom, which I made some little quick, videos about. But yeah, they did the cut. I didn't feel the cut. And again, this is something that we've done before, that I felt before. It's such a bizarre feeling when they're basically, they have like a vacuum that's sucking out the blood. They have someone that's cutting you and you can't even feel it. The only thing you can feel is the pressure that moves your head forward. And you're like, okay, something must be going on back there because my head is moving forward, so you can feel it in other parts, but it's no pain. It's just you can detect something is happening back there. So yeah, they did the FUT, they did the stitches, and I saw the stitches. They showed them to me after in the mirror, so they look fine, and they covered it with my hair. So since I already had an FUT and there was already like the scar there, they basically just cut out the scar and made a new one where the old one was. So it's not like there was any extra scarring. And if anything, I mean, the scar might actually be better, because the doctor commented, he said, yeah, your laxity was good. And we could have taken out more, but we didn't need to. Now, this procedure, I had a lot less hairs taken out. I'm not sure what the exact number was. It was probably like 2,400 or something. And my last one was like 3,300 grafts. That's not hairs, that's grafts. So yeah, they didn't need to take out as much. And I was doing the hair massaging, scalp, laxity steps, exercises very diligently. In Chiang Mai, I was like turning down, engagements. I said, no, sorry, I gotta go home early. And I was taking it quite seriously, like I always do, especially for something this serious. It's not worth, a dinner or something, messing it up. So the laxity was good. The scar is not super, I don't think it's going to be as bulging and tight. The last one, it's like they took out so much hair, they could barely close it with the stitches, and it was like bulging, and there was some discharge coming out on the sides. Anyways, they maxed it out, and that's what I wanted. That's exactly what I wanted. Without doing all that, I couldn't have had the result that I got the first time around. But this one, they didn't need as much hair. My scalp was, quite loose from all the diligent exercises I did. So I don't think there's nearly as much tension on the stitches, and they feel better. So the other thing is that the FUE, so FUT takes a while. They cut out the strip, and one by one, they have to put them in your hair. Now with FUE, taking out the hair, they have to do one by one. And then putting it in, they have to do one by one. So it's actually more tedious than the FUT. I guess I should have known that, but I just didn't realize that. So that's why this procedure, even though it had about a third less hairs, grafts, by number, it took a lot longer. So we started at 9. I got there even a little bit earlier than 9, 8:50, and we didn't finish until about 8:30. And by the time I left the office, it was like 8:45, because those last 15 minutes, I'm going to the reception, clearing a bill, getting some, a wrap up and stuff. So I barely got home. I barely got to the restaurant in time to get food, because now in Bangkok, there's currently a curfew, which is like at 10. So some restaurants close at 9. I barely got to 7-Eleven at like 8:55. It was an all day affair. Literally, it was like a 12-hour thing. So yeah, after they did the cut, I didn't feel anything. Then they started, the doctor, I heard his voice, because, you're drowsy and sleeping sometimes, but I heard his voice, and I believe he's doing most of the work as far as the extractions. So as far as doing the cut, he's taking care of that. As far as taking out the hairs, he's doing that. As far as knowing where to clamp it down and where to make the line, because that's a big decision, and deciding which hairs to take, because if it's lower on the back of your scalp, those hairs are a little bit different in density. The middle is probably thicker, and then he knows everything. The hair is like a map. And that's what I felt like. It was like your body, your face is like a canvas, because they're drawing lines all over it. They want everything to be symmetrical. They put a line on your nose, your forehead. They ask you, how do you comb your hair? Where do you part it? I put a mark where I normally part my hair. They're putting the line, for the new hairline, for the lowered hairline. They're putting extra lines for where they want to add density. So there's like different segments on it. And then they're doing everything. It's like you're a map, you're a canvas. So it's just an interesting feeling, and then all these hands on you, and his team doing everything. So once they did that, I saw them cutting the hairs under the microscope, and I don't know what the FUE procedure actually looks like, because I couldn't see it. I'm not even sure what the tool looks like. I guess it's just a puncture thing, and it takes them out one by one, but they're going through them. Now, I don't want to call it a complication, but issue that I have is I have a bunch of I'm sure you've seen other guys with this, red irritation on the back of the head, especially guys with short hair. You can see it. There's a lot of redness, and sometimes there's bumps, and it's basically, the doctor said it's just like acne. I've had other doctors tell me the same thing. I know some days or sometimes it goes up, sometimes it goes down. I think eating sugar and processed carbs definitely elevates that and gives it more redness. I think it's a product of inflammation, but I'm not. It's just weird, because normally you get acne on your face, right? But I get it on the back for some reason, which I guess is a good thing. I don't want it on my face. Better back there than up here. But anyways, so he said he was avoiding doing the FUE on the redness, on the bumps, on those acne parts. And I was like, okay, good on you. One other thing he asked me about was, what does your dad's hairline look like? Because in that band of hair, the donor area, he wants to see how high, how low, what's the optimal area to strip from. So I showed him some photos of my dad, which I only had until recently, thank goodness. But mainly you could only see those photos were from the front. So there wasn't any photos of him from the back. So that one, it wasn't 100%, but he still had a good idea, because my dad has a lot of hair on the side. He's bald on top, but even from the front, you can see his hair in the back, just popping up a little bit over the horizon of the scalp. So I think that helps. If you have a photo of, some of your relatives, especially male, direct parents, grandparents, whatever, I think that's going to help. It'd be helpful to have them on hand. Once all that got done, and it took a long time. I remember waking up a couple times. It was like 3 p.m., 6 p.m. They did tell me, if you have any issue, you need to stop, just let us know. But a lot of the time I was just like, I'm okay, we can keep going. We did take a lunch break. They were nice enough to bring me, they asked me what I want. They were like, you want rice or noodles? I was like, I'm kind of a low carb guy. Do you guys have salads? They were like, yeah. They got me a salad. It had chicken. It was a chicken salad with some sauce. They were nice enough to do that. The breakfast break was quite short. I think it was maybe just like 20 minutes, and I was able to check my phone, reply to some messages, and then we got back in there. At one point, I did ask them to stop. There's only like one point I asked them to stop because I was coughing, and I made a small like video clip of that where I just said, I don't want them to mess up because it's such a delicate procedure. You're putting a needle in, you're getting a hair out, or you're putting it in, and we're working with such precise measurements, like even a millimeter. They might be even smaller than a millimeter, and I'm coughing. I'm just gonna jab, my head forward and mess something up. I was like, so just if you need to stop, if you need to cough, for sure, if you need to sneeze, just say, excuse me, I need to just let them know they're totally. One thing I thought towards the end, it was like 7 or 7:30 p.m. It was getting late. It was dark outside, and I thought to myself, "Dad, these people are incredible." There was not a drip, not a sign, nothing of them getting tired, fatigued. I don't know, just powering down. The whole time they were on it. It's like when we started at 9:30 or 10. They were as focused and as concentrated and as energized as they were at 7:30 at 8 p.m. And I was like, I've come to the right place. Just the level of dedication and expertise from not only Dr. Pat, everyone on the team, I was just blown away. You would think after half a day, any human, it would just, you would get a little bit like, you'd lose some of your oomph. No, just the way you could hear the way they're speaking to each other. There was no tiredness in there. They were still sharp. They were still going at it. I love that part. And even down to the very end. So once they've done everything and they've actually put the hairs in the front, I'll give you guys a little bit of a close-up. So right there, you can see in the front, the bandage is kind of covering the temple area where they did most of the work. But you see the redness there is mainly from the density. They didn't bring the hairline down too much in the front. They put a mirror and they're like, hey, what is it? What do you think? What does it look like? And I said, oh, it looks fine. Now, I was still a little bit, you're under the volumes and stuff. So after I said it's fine, which I did think, but I wasn't looking too closely. So I would recommend looking extra closely, taking your time. The doctor said, I think there's a little more here than there is on this side. It was a little bit lower here than it was on this side. And when I looked again, I was like, hey, you know what? You're right. And then they were like, yeah, we can move some. And I alluded earlier to saying, like, they'll tell you stuff you didn't even know you could do. And he said, yeah, we can move some. I was like, what? I thought, like, once you put them in, they're in. But apparently, if they just put them in, and it's literally only been minutes, they can take some out of this side and put them back in to this side to make it even. They did that. I looked at the mirror again and I was like, yes, now that is symmetrical. That is even. And yeah, I didn't know they could do that. Wow. Thank goodness for them suggesting. So that's the second time in that day that I said, oh, it looks fine. And they came up with something better. And I just think that's so key. It's one of those things where, I don't know, if you went to another clinic, maybe you might not get, I'm not bashing other clinics, but maybe you might not get that level of input, that level of expertise, that level of help. One thing in general I've noticed after living here in Thailand for many years is that oftentimes, this is just in society in general, it's like okay or good, that's good enough. It doesn't need to be any better. It's fine like that, don't worry. But that doesn't apply at this clinic. At this clinic, it's excellent, or the best is what their status quo is. That is what they're regularly aiming for. And it makes me, I don't know, a little bit fired up, a little bit happy that there are people operating at that level, at that clinic. And that's the clinic that I went to. And that's, 2 times in the same day. I don't want to say that they've saved me, but that they've greatly helped me, even after I myself said, oh yeah, it looks fine. They're gonna go above and beyond. So once they, evened the hairline out, one thing he said is when you're laying down, especially on the pillows, you don't get the same angle, the same view. So that's why I said if it came out a little bit more on this side, that's just because it's hard for them to see everything the same as if we're standing here upright facing each other versus laying down on the bed and stuff. So I said, oh, that's understandable. Either way, they fixed it greatly, and just in a great way. So after that, I went to change my clothes. I put everything back on. It had been a long day. Like I said, it was well dark outside for hours. One of the other personnel walked me down to the second floor, which is the receptionist area. She gave me the medications. I'll give you guys a run through of those real quick. And you know, they collect the payment at that time, any outstanding payment that you need to give them. So I got a goodie bag. So this bag was filled with a few things. One is this saline solution. Now I have a spray bottle in my bathroom back there, but they ask you to spray it every hour to, I guess, help avoid infection. I was like, okay. The other, I guess, most important one, which they've taken the time to mark out in dark red, or is that dark pink, or is that red? Anyways, they call this one a strong pain reliever, and they said take it before you need it, because it's gonna be too late if you wait until the pain, comes to the forefront to take it. There's this other one, anti-nausea, because they said if you take this, it's so strong that it gives you nausea. So this is to help, balance that out. So those two you need to take soon after you leave, because when they're giving you the shots of anesthesia in the front and stuff, it wears off after a couple hours. So you're gonna need these, and you can see color coded for importance. This is the only one that's colored red, so it must be important. The other ones I got were this doxycycline. It's an antibiotic. And this other one is an anti-inflammatory. I don't want to say the name, but it's an anti-inflammatory, and it's a complicated name. That's why I don't want to say it. So these you take after eating. Now, as soon as I got done, I went to 7-Eleven. I grabbed a couple of chicken items there, and then I went to W District. Thank God, Holy Smokes was still open, name of an American barbecue restaurant, and I got some delicious, beautiful brisket with some sliced tomatoes on the side. So that really helped me. And then this one is a sleeping pill. Now I think that'll be helpful, because I mentioned last time when I did my first one, sleeping was one of the hardest things. And yesterday, one thing I did was I got one of those neck pillows you get for the airport. I had one before, but I got rid of it a long time ago. Anyways, I got it from Miniso. I think it's a Japanese, or yeah, it's a Japanese little product store. And so that's gonna help, because when I had the whole pillow last time, it's hitting the whole scar. If you have the neck pillow though, there's only 2 portions of the pillow that are resting on the scar, and then the point in the middle, and then the point after the pillow can kind of, be relieved of pressure. Again, my scar this time, the incision, FUT part, I don't think is as bad, so it should be easier anyway, but I'm prepared. I got the neck pillow. I got a towel from Home Pro, and it's just some fine 100% organic bamboo towel. It was extra soft, and I felt the towel on purpose. You don't want, it's up to you, but I don't want one of those rough towels where you're touching it. The fibers are so big, they're so rough, they're so dry. No, this one, it's halfway to silk, and that's what you want. Something smooth that's not gonna cause a lot of friction. Don't worry guys, we're wrapping up. I know this has been a long one, but this is for the people that are genuinely interested to get a hair transplant. If you're really thinking about it, maybe you've already booked it, especially if you're interested, DHT in particular, I'm giving you the rundown of every little detail. I can imagine, I've never been to any other hair clinics, but I can imagine some of this is gonna be similar. So just watching this will give you an idea of exactly what to expect on your operation day. Now this is one of the last things that was in the goodie bag, and this is a small painkiller. So they said in between taking the hardcore, dark pink labeled one, if it still hurts, they said you can take one of these, which is I guess like a Tylenol, and this is like an intermittent one. They said it's optional if you're still experiencing any pain. I also got this manual. It's not a manual. It's just a piece of paper with instructions, post-op instructions, which is nice because I guess they've emailed it to me, but just having the paper makes it a little bit easier, especially for someone who's drowsy like me. At that time, now I'm doing fine. I'm making a video, right? The gauze. They said if there's any bleeding, use this gauze. Do not use tissue paper or Kleenex, because they said that will stick to the grafts and maybe will help, loosen them. They said use the gauze. This is specially made for your hair transplant, your grafts. So that's going to be useful. Last thing they gave me was this pair of gloves. They said if you need to, put some ice in the gloves. You can tie them together, put them, across the graft site or across the back if you need. I don't think I will need these. I hope I won't. Yeah, they just give this to you. They said just in case. So they're being extra thoughtful, and that's all the stuff they included. Now, I came home, I ate dinner. I didn't, all I did was those 2 McMuffins and the salad earlier. That's not enough calories for me. I think if you're recovering, actually, your body needs more calories, right? So I just tried to go for some of that, that chicken, that meat. Now, the reason I did that is because I've been eating low carb lately. Because when I eat processed carbs, especially sugar, but like, white bread and stuff, I get inflammation. Everyone's body reacts differently. Try to test out what works for you. If you don't know what works for you because you haven't tested it, I would say for most people, their body is going to react to carbs, especially processed carbs and especially sugar. For most people, this isn't a secret. They will break out, they'll get redness, you won't feel as good eating too many carbs. But meat rarely makes people break out. So I would say, eat a little bit heavier on the meat. One other thing I like to eat often is these mixed nuts, so that they're high in fat, the good fats. And anyways, this is just like, these are extra, like, I don't want to call them pro tips. I'm not a pro, but this is just, I'm trying to do everything to help my recovery, to help reduce the pain, inflammation, everything. I think that's mostly it, guys. I hope someone out there finds this useful. I know when I was getting my first hair transplant, a little over 3.5 years ago now, I got it in March 2018. There was not a lot of good content. Normally, what you will see is people, they'll just, 6 months after their hair transplant, they'll be, oh, look at my great hair now. And I'd be like, what about everything before that? What about the transplant day? What about, I want to know in the trenches, on the daily, give me the details, the good, the bad, not just the pretty hair after. So that's what I'm here to give you guys. I hope someone finds it useful. Anyways, it's been a long one, guys. So if you made it here till the end, you are serious about getting a hair transplant. Drop me a comment, send me a message on, Instagram, like I've said before, Saulist or something. I love getting in touch with you guys because this is such a personal topic. And I don't get a lot of comments, honestly, so I can reply to all of them. Don't worry, I'm not one of those, I'm not a YouTuber at all, but I'm not one of those big YouTubers who's just, inundated with comments and whatnot. So let's leave it there, guys. Let's keep in touch. Today is, October 12th, and I just got my second hair transplant. It's 11:20, and I'm about to hit the hay because I have a post-op appointment tomorrow at 11 a.m. Gotta be back at the clinic. They're gonna help wash me up, take care of everything. Guys, it's been a pleasure. Talk to you soon.